We just want to say, Ebenezer, this is how far the Lord has brought us. It's so exciting and it's amazing to come before you once again. And thank you so much for the wonderful and the generosity that you displayed the past year when we came before you asking you to help us to have a community clinic. And it's amazing how the Lord used you to start this clinic. Now, as I stand here, I can just see from here the clinic coming up and it's almost done. And it's happening because you gave generously. This year around, we are coming before you to ask that though the building is up, we still need a lot to be done.
Joshua Donko, a father to Philip Donko, a beneficiary of the organization. He works as a public washroom attendant. He starts work at 4 a.m. and closes at 11 p.m. He does that at a great health risk, since he works with fire and cleanses the washroom without a protective gear.
Say, my basic clinic be what Ofadama inside. But clinic no almost
Seen
here no
them
almost
build the
here.
clinic,
But be almost there
but
no.
it's not completed yet.
Say
But I'm happy with the progress so far. I'm very happy because it will be of great help to my family, looking at the distance from here to Kolebu Teaching Hospital. I've been ill for the past 3 days and was admitted for 2 days and was saved by God's grace. She's a mom to some of our beneficiaries, Beatrice and Jennifer Jato. She works as a food vendor. She sells rice in the community and she wakes up at 3 a.m. to prepare for work and always exposed to heat and poor environmental conditions. This poses some health problems.
I was very happy when I heard of the ongoing clinic project. We are financially handicapped, and considering my job, having to pay hospital bills is always very difficult. The news of the clinic project has brought us lots of joy, I must admit.
Lebdonko's mom also had to share her excitement on the clinic project and how beneficial it's going to be to her and her entire family.
Amofop has been of lots of help to my family. They supply our children school materials like books, uniforms, and school bag. The news of the clinic project came to us as a tale, but now it is a reality we are all excited about. I'm glad I will not have to take my children as far as Kolebu or Osha Clinic for medical attention when they are ill.
Some workers in the community's yam market were not left out. We took our cameras to the market to listen to what they also had to say on the clinic project.
Paying for transportation to the hospital is even a problem. On reaching a clinic, it's always very difficult to get proper medical attention with little money. Even with the National Health Insurance card, we are given prescriptions to buy, which we can hardly afford most of the times. Sometimes our medical conditions demand emergency, but due to distance, they sometimes end in tragedy. We are asking for God's blessing and strength for you so that Amofo can complete the clinic project they've started. I work with fire, and my job comes with a couple of health hazards. We are sometimes delayed due to inadequate finances when we are ill and visit the hospital, which can lead to extra health complications. We are hoping that the clinic will have a subsidy initiative to help us in paying our bills.
Secondly, we trusting the Lord that is going to provide for us a charitable fund so that some of our vulnerable kids and families who come there and they don't have any means to pay for their medical bills, the charitable fund can take care of that for us. Sometimes it's very hard for some families to access healthcare. And we believe that with the charitable fund, some of these emergencies can be taken care of.
It's a very good initiative by the Amofop team because of the financial crisis in the community. I talk about um, quality health, and the access to quality health here in the country is very, very, very high. It demands a lot of money, so this triggers people not to go to seek for quality health care from the hospitals, having a mindset of high demand from the hospital bills, and all sort of things. So the introduction of charitable funds will be of a great help to the community, where hospital bills by um, patients from the community will be covered, and that will improve quality health care in the community.
to serve as unemployment for those of us who have practiced in the medical field to work over there and also give competent care to those who come and access healthcare. Secondly, it can serve as a cheaper form of healthcare for the people in the community since people find it difficult to access healthcare. Thirdly, if there's any emergency case, the clinic can serve as a first line of treatment or even a form of management before the person can be referred to a higher facility. Also, having competent staffs working over there will give the people a form of boost to access the clinic instead of purchasing medication from over-the-counter practitioners to boost the morale of our young ones to take their studies seriously so that it can be like us or even be more than us.
In the presence of all of us gathered here, now direct that the ground be broken for Arm of Hope Ghana in collaboration with Arm of Hope USA.
Before we start the work, okay, Mr. Philip let me know that they have some of the boys under their program, so they need work. So I said, no problem. So I employ them. Kwiku, Francis, Thomas, and Maxwell. I bring all on board. So I brought my workers. At times when we come, we call them. If they are free, they work. If they are not free, it doesn't work. Then moreover, add some of them at the community, employ those people in the community too. So how we start the work. Out now, still I'm employing them. If I come, if they are ready, they come and work. If they are not ready, we'll find some people and work. So everything is going smoothly.
After the building is done, we have to hire 2 medical staff or doctors. We need 2 physician assistants. We need a lab technician. We need 1 pharmacist. We need a clinic administrator. We need a office manager. We need 2 security officers, and then we need 2 receptionists to help us with our work. And all this will require resources. We are trusting that the Lord will provide for us. At least we can be able to have this to sustain them for a year. And after we make some money from the clinic, then we win off.
Those people are the community, the warriors. When we start digging for a basic profile, this man will come, they call this chief, even police people will come, hear me. They will take our tools through Mr. Flip intervention before we can get the tools back.
So we are calling on you once again this year that let us help, let us support, let us give so that our clinic can come to a reality. It's our prayer that by next year, December, our clinic can be functional. And with that, it's going to serve so many people. In fact, the testimonies and how people are so excited that this clinic is going to come here is very phenomenal. And we believe that a lot of lives are going to be impacted through our staff who are God fearing, who are going to impact them with Christ like care. And we believe that, together we are making an impact. Thank you so much for coming, and we believe and trust that tonight we're going to give to support the medical clinic. May the Lord bless all of us. Bye-bye.